Hey docs, Dr. Amy here. One of the things, probably one of the biggest things I have heard over the years in the Focus Academy is we have doctors come in, they're doing great chiropractic work. They're definitely not just limiting themselves to back pain, muscle spasm, headaches. They're even working in the pediatric realm. Awesome. And they're saying, hey, I am doing brain-based care because I'm scanning. I'm doing thermal scans. I'm looking for pattern. I'm looking to make sure I see change there. And I'm seeing a lot of kids, and I'm seeing a lot of kids with behavioral learning socialization challenges or adults. And the thing is I love that. That's wonderful. But oftentimes what we see is once doctors have been doing this work for a little bit of time, they start to go, I realize, and they don't realize it at first, but when they start to develop this brain-based understanding, they start to realize that they have replaced chasing back pain and symptoms and musculoskeletal stuff with chasing scans, looking for change on scans, and that being the objective of the care that we provide. So when we get to a re-exam, if let's say we see change on scans, but we still have challenges going on with the child, we still have the same behavioral challenges, or maybe they're worse, or we still see on our physical exam, if we're doing it, that they have reflexes that are not integrating, or we see that they're having, they're having some of the same challenges that they were having, but the scans have changed. What happens is, because we've become so monocular at looking at, hey, my objective is to change the scans, and if I change the scans, we're going to see change with the kid. And oftentimes that's the case, but if we don't know what we don't know, if we don't know how to look for the consequences of the subluxation, we're looking for indicators of subluxation with the scans, wonderful. That's not the end of the story. We have to also be able to look for the consequences of altered neurological function and what that looks like in the developing child as far as your functional brain-based exam. So we say, hey, we're not treating the symptom, we're not treating ADHD, we're not treating hyperactivity, we're not treating autism, we're not treating sensory processing disorder, any of these things. We're looking for altered neurological function that may be impacting the way this child is functioning in their life. So on our clinical exam, we're looking for clinical clues, one of those things being thermography, one of those things being maybe the way the pupils react. We teach you how to do that. One of those things maybe being heart rate variability. Wonderful. We get to take it a step further and say, if we see altered neurological function, we see indicators of that, what are the consequences of that altered neurological function, i.e. subluxation? What are the consequences of that to this child on their developing brain, in their developmental trajectory? That's where we get to bring in the pieces from our functional brain-based exam, simply like primitive reflexes, like gross motor function, like fine motor function, like auditory verbal processing, eye movement patterns, visual cognitive executive function challenges. We just simply get a big picture so we can stop looking just at, hey, am I seeing change here on my clinical indicators, and am I just chasing change, trying to create change, and not understand how it's impacting an individual? This ability to understand the big picture, to monitor the big picture by just simply adding a functional brain-based exam into what you're already doing with looking for subluxation, this allows us to set appropriate goals. This allows us to stop chasing symptoms. This allows us to build better retention because we can help parents understand what to look for based on what we expect to see on functional brain-based exams, right? And changes in the functional brain-based exam, and changes we would expect to see a child in their life start to experience. So we don't just chase the symptom, we don't just chase the scan, we are looking to address the consequences of altered neurological function and be able to simply communicate that. And it allows us to simply communicate that as a part of a team, that some of these kids need a team. Some of these kids need an occupational therapy approach, a neuro-optometric approach, biomedical approach. And this is what allows us to understand, really lead the brain-based discussion of why an efficiently functioning and uninterfered with nervous system has to be at the foundation of everything else. See, one of the biggest things I've seen over the years of teaching this work is doctors will go, I do this work, I scan, I look for subluxation, I'm not chasing the symptom, I'm not treating the symptom, but because they don't know more, they end up treating the scan. They end up treating the objective indicators to try to force change there, as opposed to understanding the bigger picture. This is what gives us the ability to have a better understanding, be able to answer the tougher questions, be able to understand some of the tougher questions of why we're seeing what we're seeing, why sometimes a challenge that a kid might be having is actually a win. You know, if you are going, hey, I want to know more. I don't want to do more. I want to do chiropractic. I just want to understand more about what I'm seeing, what I should be looking for, how to connect with parents, how to understand why I see some of the changes and challenges I see with kids when they start under care. The missing piece there is looking at that functional brain-based exam, knowing what to include in it, and how to put together a big clinical picture that doesn't leave you chasing deficit or symptom, doesn't leave you trying to force change on clinical indicators, as opposed to understanding why you see change, but allows you to respect the developmental trajectory for each individual and put all the pieces together. So this is where we start to, really have some self-discovery in ourselves of how we're practicing, and see where we can make some little upgrades. And the first thing I would ask you to do is to just look at, hey, am I doing that? Am I kind of chasing deficit, but in looking more at the clinical realm of trying to force leg lengths to change, or force patterns to change, or see change on the thermography? Am I doing that? And like when I go back into a re-exam, if I don't see change on the scans, or I do, but it doesn't match the clinical presentation of how the kid is doing, does it make sense to me, or do I get a little nervous when I go into the re-exam because I don't know how to explain that? If that's you, or if you're testing primitive reflexes, let's say, or gross motor, eye movement function, but you don't know when to give exercises, or if you should work with a neuro-optometrist, or let's say you're checking those things and you are giving exercises, and maybe not understanding the role chiropractic fits in. This is where, with this brain-based approach, we get to put all those pieces together, respect, and rightfully so, make sure chiropractic and unaltered and efficient neurological function is the foundation of everything else, but then respect the other things that need to be in there in the form of the functional brain-based exam, and be able to lead the conversation. If this is you, then you're in the right place, and we're here to help you. And everything in here, go back, watch lessons, lean into the certification series, lean into some of the other content, take some of our virtual CE classes, look at a lot of the questions and research that's been posted in this group. This is the place for you if you're like, hey, I love chiropractic, or I want to know more about why chiropractic is important. I'm a chiropractor and I don't totally get it. If that's you, you want to keep chiropractic at the foundation, or figure out how to find simplicity in that, and yet you want to know more, this is the place, and we're happy to have you. And the people in your community need you, because we're hearing more and more and more that just the schools are overrun with challenges. Teachers are opting out and looking for other careers. The classroom is full of IEPs and 504s because these kids are struggling, and there's just not enough people to help. And we need chiropractors to be able to lead with the brain, to make the case for what we do, so we can help more people. So be well, my friends. Do good work. Happy to have you on this mission with us. And the people in your community, they need you to step up and know more now.